Assalamualaikum warahmatullahi wabarakatuh. Greetings to Madam and all the respected panel. My name is MUNIRAH BALQIS binti SHAMSUL BAHAR, student ID 2023600488, and today I will present to you for subject BTM543, Ethical Communication Management, and the topic that I choose is Ethical Communication in Healthcare Organization. When we hear about communication, we usually think about talking or giving, but in healthcare, it is more than that. Ethical communication means sharing information honestly, respectfully, and responsibly. Because healthcare decisions involve real people and real life. Because the way that we communicate with people can affect to the patient safety, trust, and the quality of care. Who is involved? So, in healthcare, ethical communication does not only involve the doctors and the nurses. It also involves the pharmacists, the patient, administrators, the family members, and all the support staff. Basically, anyone who is part from the healthcare system is playing the role for the ethical communication, whether they are providing care or just supporting the organization. So, what is the ethical communication? Ethical communication is being truthful, respectful, and professional when we sharing information. It means giving accurate information, protecting patients confidentially, and respecting patient dignity. It also means that following professional ethics and not taking the shortcuts, whether the situation were busy or stressful. Next, when and where does it apply? Ethical communications happens every day in healthcare organizations. First, during patient consultation in hospital and clinic. Ethical communication helps patient understand their condition and make decision for their treatment. Second, during team handovers and meeting in wards and department. Ethical communication ensures important information is shared clearly, which helps prevent mistake. Third, during incident reporting and documentation within healthcare system. Ethical communication promotes honesty, accountability, and patient safety. Next is why is it important? Ethical communication is important because it builds trust. When patients feel listened to and respected, they are more confident to trust in healthcare providers. It also reduces misunderstanding, improves teamwork, and also avoid the legal and ethical problems. Most importantly, it helps for better and safety for patient care. How to communicate ethically in healthcare organization? To communicate ethically in healthcare organization, there are some simple do's and don'ts to follow. Healthcare professionals should speak clearly, be honest, and use the respectful language at all times. They should listen to the patient carefully, show the empathy, and also protect the patient privacy. At the same time, they should avoid sharing patient information without permission, giving false or unclear information, or ignoring the patient's concern. Following ethical guidelines helps maintain the professionalism and trust. We are getting there. So, in a real-life example, the doctors can explain to the patient honestly without giving the confused medical terms to the patient. Nurses also do the practice of the ethical communication by keeping the patient information private when do the handovers. From the management perspective, ethical communication happens when the hospital management communicates openly and responsibly when it comes to the complaints. Or to conclude, ethical communication is not just a guideline, but it is a daily practice in healthcare organization. By communicating ethically, healthcare professionals can protect patients, support teamwork, and also maintain the trust within the healthcare system. That's all from me. Thank you for your attention.